From the top in 3, 2, 1. Seeing is believing, so they say. Care providers at a New York City hospital believe that if they can see how well prepared expectant mothers are to care for their newborns, the result will be great improvement in community health. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer with AHA, and your host. New York-Presbyterian Hospital's idea to pay virtual visits to the homes of at-risk pregnant women took top honors in the American Hospital Association's 2019 Innovation Challenge, which encourages finding new ways to use technology to address social determinants such as food, housing, transportation, and jobs. The plan is to leverage New York-Presbyterian's telehealth platform to gain a unique view into the home environment and identify risk factors that could affect maternal health and early childhood development. Health providers would be in a position to spot potential problems and intervene early, supporting positive parenting. In this podcast, Priya Bathija, Vice President of the AHA's The Value Initiative, speaks with the New York-Presbyterian team about its award-winning approach to maternal and infant health using today's technology. Speaking in order, her guests are Leora Hoffman, Manager, Psychiatric and Adolescent Clinical Services, Davina Prabhu, Vice President of Ambulatory Care Network, and Tatiana Blue, Manager of IT Innovation. Let's listen in.
Hi, this is Priya Bathija, and I'm Vice President of the American Hospital Association's Value Initiative. Today I'm here with the team from New York-Presbyterian to talk about their award-winning model that they submitted to AHA's Innovation Challenge. So let's just dive right in. The first question I have for you is, tell us a little bit about why you needed this model and the problem that you're trying to solve. Leora, do you want to start off?
Sure. So we know that unaddressed social determinants of health in the first 3 years of life can have substantial downstream consequences and contribute to multi-generational health risks for both the mother and child. One of our hospital sites is in Washington Heights, and we know that there are over 13,000 children in the area in Upper Manhattan, and roughly 34% of those children and families fall below the federal poverty line. And so we really wanted to come up with innovative ways to screen and address social determinants of health-related risks in early childhood and in the postpartum period.
Great. And I think, Davina, you wanted to add some more thoughts?
Yeah, I think one important thing to note at New York-Presbyterian is that we focus on the health of the community, obviously. And so we need to understand the needs of the community. And so in understanding publicly available data, we actually used stats from the Citizens Committee for Children. We really realized how we could design interventions using a digital platform for this population.
So, Leora, how is this technology going to improve patient engagement and follow-up care for the maternal child dyad? Can you sort of walk us through how the model will work?
Sure. So we wanted to target maternal health and well-being, child health and development, and the dyadic parent-child relationship by addressing the social determinants of health factors in early childhood. The way we thought to do this was by implementing a Healthy Steps model through telehealth technology. Healthy Steps is a national evidence-based model that embeds a child development professional within the primary care team to address basic new mother and early childhood needs. Conducting Healthy Steps through telehealth visits as opposed to in-office traditional visits allows us both to access patients who might otherwise be lost to follow-up, as well as provides a unique view into the patient's home and to be able to see the social determinants of health-related risk factors. So how are we going to do this? We propose that a Healthy Steps specialist will conduct virtual video visits for high-risk expecting mothers who are often lost to follow-up, from prenatal care and following them all the way through the early stages of the care of their children. The virtual visits will allow for a unique view into the home environment so that we really can address these social determinants of health and see it within the home. So for example, we'll have a prenatal virtual video visit, which will assess the mother's readiness for birth. Does she have access to a safe sleeping space for the child, access to basic furniture needs, food supplies? We'll also have follow-up virtual visits that will follow the child throughout the first couple years of his or her life. Those visits will focus on maternal well-being, so improving engagement and follow-up care. We really want to target maternal mortality. Often moms don't make it to their 6-week postpartum visit, and so we really want to make sure they're engaging in that. We'll also be able to do enhanced developmental assessments. So we'll be able to see the home and see, does the mother have access to developmentally appropriate toys? Prepare the mother for when the baby starts crawling and making sure the home is safe, ready for that developmental stage. We're also going to focus on healthy attachment, being able to observe the mother and baby in their naturalistic home environment to be able to support positive parenting techniques.
That all sounds really great. Tatiana, I know you worked closely on developing this project as well. Do you have other insights to add as to how it is going to work?
Definitely. So as Leora mentioned, we are trying to reach patients who typically would be lost to follow-up or not make it to all of their follow-up visits. And so when we think about patient engagement, it's really important for us to build technology that will help us meet the patients where they are so they don't have to come into our health system. And telemedicine gives us the ability to do that. They're able to do these virtual follow-up visits from home. They don't have to worry about the typical barriers to care, such as transportation, needing childcare, taking days off of work, and the sort. So telemedicine really helps us improve the current model that's happening in person.
Great. So you've touched a lot on how this model could enhance the patient experience and make this a better life experience for the women in this community and their children. Through the Value Initiative, we're also looking at how models can not only enhance the patient experience, but also lower costs and improve health outcomes. I'm assuming that this model could also do those things. So, Leora, could you share the results you hope to see in terms of cost and outcome?
So to touch a little bit on healthy steps first, there are demonstrated impacts that healthy steps has on the child's health and development, early nutrition, child safety. So for example, less ED visits for children from injuries, parenting knowledge improvement, impacts on maternal depression and physician satisfaction, and many more. But beyond that, Healthy Steps has also been shown to have a positive impact on cost savings. Healthy Steps serves over 30,000 families each year and is estimated to save the Medicaid program up to $1.2 million annually. And these savings really come from improving well-child visits and immunization rates, promoting early dental health care, encouraging appropriate use of care, and providing additional support services to families that reduce costs to the overall system.
Wow, those are some significant outcomes. Davina, do you have additional outcomes that you think could come out of this that you'd like to share?
Well, I think, we're studying it, specifically at New York-Presbyterian, where we're unleashing this entire digital transformation. We're looking to see, how do we scale this? And once you see scale, then you start to see the outcomes. And so as we study some of the things that Healthy Steps is doing in partnership in this model with us for this proposal that we put forth, we're starting to see that, especially when it comes to utilization, how do we actually help avoid those that are avoidable so that we drive down utilization as a result. I think you see the similar types of outcomes when we think about other value-based initiatives such as the district program or patient-centered medical home, where there's a focus on access and what we can do as far as driving value in that way. Early well-child visits, actually through the patient-centered medical home initiative, have, reward from a cost perspective associated with them. And I think what we start to see is how we align with all of the different value-based initiatives going across the board and making sure that our digital platform really supports that.
Right. So, Tatiana, do you have other thoughts?
I think what's also important to add is that we're not looking to replace in-person visits with a telemedicine visit. We're looking to add incremental volume, incremental access. And really what that does is help us, as Davina mentioned, for other diseases and illnesses, is to really improve outcomes for those as well. So a patient will come in for their, annual checkup and may need an additional visit just to touch base for medication adherence and chronic disease, and that will help us improve chronic disease outcomes as well. So telemedicine really allows us to reach patients in those in-between visits that they may not come in person to have.
Yeah, thanks for making that clarification. I think it's often important to show how telehealth can not necessarily replace care that we are used to giving and providing in our healthcare environment, but enhancing it. Mm-hmm. And this seems to be a great example of how that could work in real life. And Davina, you mentioned New York Presbyterian's other digital health offerings. And so we know this isn't your first rodeo in the digital health space or the value-based space. How has the experience you've had in other areas helped you build this model in a way that can be successful in the future?
I think what's so important to note is what we just talked about, which is we're not looking to replace the in-person visit. We're looking to enhance using the digital platform. So knowing what drives value, especially in the programs that are already out there, like I mentioned, patient-centered medical home and the delivery system reform payment program, the DSRIP program, we've noticed what we need to really focus on. So we actually started in same-day access and seeing how in primary care can we actually make sure that all of our patients who need to see us can see us within 24 hours. And that has been widely successful for us. So we started to understand what are the types of technologies, what are the models, how do our patients actually respond? Because our patient population is still new. There's some customer awareness that we need to build when it comes to a digital platform like this. And so making sure that things are available in the languages that our population speaks, making sure that they feel comfortable accessing it, not through maybe a smartphone, but actually maybe coming into our sites. We think that over time, we'll be able to build that trust with the digital platform as well. And I think all of that really set the stage for having a model like this designed. Because once you start to look at primary care overall and same-day access, you can start to pinpoint the actual places, whether it's around prescription refills and certain types of things that really meet the needs that our patients have. And so, understanding again the needs of our community and our households with children, below the poverty level, where we're like, wow, we have now proven concepts of how to engage our patients into this type of platform. So now let's use it and move it into a deeper level of engaging with our patients.
Tatiana, you come at it from the innovation perspective. So how have you used lessons learned along the way in different innovation efforts as you build out this model?
I think what's important for our team, the innovation team, is that our leadership really guides us to think about technology as a very small piece of the puzzle, that the technology really only makes up 5% of this, and 80% of it is people, and the other 15% is process. So we make sure that we lean heavily on our clinicians. They know their patients, they know their care models, and we also know that it's important to take the patient perspective as well. So as Davina mentioned, we really had to go in and shift some of the way we think about this, that there may not be a one-size-fits-all telemedicine program for all of New York Presbyterian sites, and we may have to tailor some things, being culturally sensitive, understanding the language that patients want to receive their care, and also meeting them at their level of health literacy.
Great. And Leora, you want to add some things too here?
Yeah, I think it's important to mention that over the last year, we were also awarded a CMS Innovation Grant through the Accountable Health Community Model to test whether implementing universal screening for social determinants of health can impact the triple aim. So improving healthcare, improving population health, and decreasing costs. And through this, we've done a closed loop navigation platform through IT, which has really helped us identify the needs and respond. And this has really set the stage also for this proposal now that we are able to universally screen for social determinants of health risk factors.
Yeah, that's really great and really important. And, as we've highlighted through the Value Initiative and various resources and tools, we know how important it is to have that social needs conversation as a starting point to addressing social determinants for your community. So what does success look like for this model, Leora?
I think it will be really interesting to compare typical in-person healthy steps to that being done through telehealth and to see how the results compare. So we're excited to do that. One of our clinics currently has an in-person healthy steps specialist. While it's an extremely effective intervention, there are still families that are lost to follow-up that have difficulty making it into the office for visits. And so we really want to see, does telehealth help us reach those families?
That's great. And so you guys have put together a great proposal. You have a lot of experience behind it. If another hospital or health system wanted to start down this path to implement something similar, what advice would you give to them? Davina, do you want to start?
I think first, going back to what Tatiana's point about the people being the main part of this, and then the process, and then the technology as the helper, is the main driver. Having committed clinicians and teams that come together who really want to come up with ideas and innovative ideas to put this forward for our patients is of utmost importance and really the key to success in doing any of this. I think that also understanding the needs of your community, just so you know where to target your digital platform, is so important. You know, at New York-Presbyterian, we've understood the importance of maternal health and early childhood well-being and have really placed that as a focus of our attention. And so having a proposal like this is just one of the ways that we're going to do that.
I think I would also add having the support of organizations like the American Hospital Association to really see the benefit that this could have for patients, because there is a cost associated, right? And so having the funds to help jumpstart this program and really start to prove the model is really important. So we appreciate you having this challenge and, awarding us with the prize. We're really excited for that.
Well, we're really excited about it too. Before we end, Leora, I'm sure you have some thoughts on that could help other hospitals as well. So
I think what really makes the difference is having support from leadership. Our hospital has set forth strategic plans that have prioritized maternal health and early childhood, and we have the support to engage in innovative solutions to address these problems. And that really makes the difference in terms of setting the priority and having support. Also, really having champions across disciplines and on the front lines doing the work makes a big difference.
Well, thank you all for being with us today to talk about your winning model. Congratulations to all of you for being a part of it. And we're looking forward to see what comes next and how we can all work to collaborate to improve the social determinants around the country. So thank you again for being with us.
Thank you.
Thank you.
The top three concepts, including New York Presbyterians, were announced on July 26th by the AHA Center for Health Innovation at the 2019 AHA Leadership Summit in San Diego. The $100,000 top award will help to fund a program in northern Manhattan to conduct virtual visits in the homes of mothers who are at risk for not receiving health care. This has been Advancing Health, a podcast from the American Hospital Association. Thanks for listening.